Welcome, everyone, and sincerest thanks to each of you for joining us this evening. My name is Karen Lambert, and I am the Executive Director of the Florida Podiatric Medical Association. On behalf of the Florida Podiatric Medical Association and the Florida Podiatric Medical Society, it is with tremendous pleasure that I welcome you to the inaugural edition of the Florida Foot and Ankle Fellowship Society's Roundtable of Excellence. What you will witness this evening is the advent of a new statewide fellowship that was launched at the start of this year. This collaboration is the first of its kind nationally, and the Florida Podiatric Medical Association takes great pride in presenting this series and helping to contribute to the education of postgraduate podiatric fellows in the state of Florida. The Florida Podiatric Medical Society was formed in 1927 as the philanthropic arm of the Florida Podiatric Medical Association. While FPMS is separate from FPMA, the society was formed by and for association membership to assist in procuring new sources of funding, which are used for scholarships, academic awards, research projects, public and professional education, disaster relief, and podiatric care for underserved populations. The FPMS motto is giving back to the future of podiatry. The mission of the Florida Foot and Ankle Fellowship Society is to encourage the growth of fellowship training opportunities in the state of Florida, plant the seeds today for Florida's future thought leaders, innovators, educators, and researchers, and promote the advancement of podiatric surgical training and education through advanced fellowship training. The goal of the FFAFS Roundtable of Excellence is to create a monthly educational opportunity that creates dialogue between fellowships and residencies. This series will feature different topics to be presented each month by the participating fellowship sites. This series is meant to highlight and feature the strengths and focuses of each fellowship program and will allow prospective residents to gain insight into and interact with various participating fellowships. Funding for this initiative provides our industry partners with the opportunity to be involved with education of a subset of foot and ankle surgeons looking for superior information and education. This evening, I wish to recognize and thank Paragon 28 for their very generous support of this program. I would like to express my sincere appreciation to all of you who graciously assisted us to make this event come together to become a success. Together with FPMA and FPMS, thank you all for joining us this evening to give back to the future of podiatry. Without further delay, it is my pleasure to welcome Paragon 28 and ask that Brian Aspen deliver their results and remarks. Thank you.
All right, Karen, thank you so much for that wonderful introduction. I really appreciate it. As far as a few of the slides that we have, can I share that deck or should I?
We're ready to go, Brian. We can turn over control to you if you'd like to drive, or we're happy to do so.
All right, how does that look for you?
Excellent.
All right, well, thank you for inviting us. I want to definitely thank Karen for setting this all up. The FFAFS, the Florida Podiatric Medical Association, and especially Dr. Perler and Dr. Bellis for all your hard work bringing this together and allowing us to be a part of it. But just let me tell you a little bit about Paragon 28 and who we are. Paragon 28, Paragon is a word that stands for a model of excellence or perfection. And then 28 is the number of bones in the human foot. And so being a company that's exclusively foot and ankle It's something that we wanted to make sure that we maintain our loyalty to that area of the body. And we wanted to have that included in our name, so we didn't feel like anyone would think we're going to expand to upper extremity, spine, anywhere else. We are an exclusively foot and ankle company, and that's why we're so glad to be partnered with this association full of people that are specialists in the foot and ankle area. This is a great quote from Dr. Blum from Osceola. He says, if you're a surgeon that thinks about why you do the things you do, you're probably using P28, because a lot of people out there say a screw is a screw is a screw, a plate is a plate is a plate. But when it comes down to all the thought and research that goes into each one of our products and the way that we develop them so that they have an impact on patient outcomes, either by doing whatever we can to have that plate be a little bit less prominent, doing everything we can to make that locking mechanism be just a little bit stronger, doing everything we can to utilize an alloy of titanium that's just a little bit more pure than other alloys that are out on the market. Those are all things that we put into our products, and we really do have a great deal of thought that goes into each thing that we produce. So here's just a few of our products built on a solid foundation. And one thing we really pride ourselves on is education. So we do offer a lot of educational opportunities. And it was great seeing the names of everybody that was logged in here so far, because I saw a lot of names that I recognized from our courses, people that have registered either to our online virtual courses or have actually come up to Denver for some of our courses as well. And we're going to continue on with that as we train people how to utilize these products or learn the surgical techniques where these products are utilized, as well as all the new products that we're going to be launching here towards the end of 2021 and into 2022. So as most of you know, we did purchase Additive Orthopedics. They are the first and only FDA approved 3D printed talus in the market right now. And it's a talus spacer that replaces anybody's talus that has AVN, or whatever other reason you might need to have a talar replacement. And we offer training on that as well. If that's something where you work in the hindfoot and you would like to know more about that, absolutely feel free to reach out to me, and we could certainly help you out with that. Now let's talk a little bit about the reason why we're having this meeting tonight and kind of the motivation for that: social responsibility and humanitarian efforts. So when our company was first founded, Albert DaCosta, the CEO, had this vision of the Tom's shoe model, where somebody in the United States buys a pair of shoes and they donate one to an underserved area of the world where somebody doesn't have a pair of shoes. And it was always our goal, and it continues to be our goal, to strive to do that one-for-one opportunity. And in the meantime, as we're building, as we're growing and getting there, we do have so many groups that we are helping and involved with right now. And one of them you're going to hear a little bit later from Dr. Mark Myerson, his Steps to Walk Foundation. We're heavily involved with that, as well as many others in providing grants, providing products, providing all these other things. But I have a huge favor to ask of everyone here as I kind of wrap up. We're looking to try to develop a humanitarian kit for these types of experiences where surgeons go overseas to underserved communities. And what we need is input from a lot of smart people out there, a lot of people that are on this call that could give us even more information. What needs to be in this particular kit? What products could we put in there? Cannulated screws, K-wires, instrumentation, plates. What is it that we need? What are the quantities that we need, so that we could develop this type of a kit, so when somebody is going to one of these humanitarian efforts, they could say, P28, could you send us 2 of the humanitarian kits? We're planning on doing this many surgeries. But we're looking to partner with people just with their knowledge and input to try to develop a kit like this, so that we could put some of our products in there and send it out to be utilized elsewhere in the world. And again, thank you so much for our partnership here, Karen. Really looking forward to continuing this. not only just from a humanitarian standpoint, but also from an educational standpoint. We look like we'd be very well aligned, and we'd love to continue on with this type of a partnership. So thank you so much for inviting us and allowing us to help sponsor this inaugural meeting.
Well, I wanted to start off, this is Dr. Perler. I wanted to start off by thanking the FPMA for believing in the mission and the vision of the newly formed Florida Foot and Ankle Fellowship Society. And more specifically, I wanted to spend some time thanking Karen Lambert, the executive director of the FPMA, and Alyssa Lambert and all her staff for their efforts in getting this new webinar series organized. It took a lot of work behind the scenes, and I'm really confident that it will be worth it in the end. And also, Brian, thank you very much. A special thank you goes to Paragon 28 for not only sponsoring tonight's presentation, but also playing a key supporter of missionary medicine projects like you're here about tonight. And I think it's an awesome idea to come up with a missionary kit. And I know a lot of people on this call are humanitarian minded, so we'd all be happy to help out and give some input to you. And finally, I want to thank Dr. Mark Myerson and Dr. Mark Wavrunek for taking time out of their busy schedules to participate in tonight's session and for their service to humanity beyond the walls of their personal practices. So the name of the talk is We Are on a Mission and Extending Your Expertise Beyond the Borders. And we'll go ahead and get started with that. If I can get my slide to advance. There we go. So I wanted to start by talking about what and why of a mission. So for me, the journey has to really start from within. It's a call to service that really happens at the level of the heart. And prior to making any decision to spend your life in the service of others, you have to come across inspiration. And that's kind of what I'm going to share with you. I'm going to talk about the why of why we do these missions. And I came across this quote from Gandhi, and it says that on the day I was born, I cried as the world rejoiced. And I hope to live my life so that on the day I die, the world will cry as I rejoice. And I guess this is really fitting now more than ever, because if you think about it, humanity is actually being tested as we speak. From COVID-19, we've seen these community flattening earthquakes happen, uncontrollable fires all over. There's ongoing power struggles in the Middle East, and there's intense political standoffs and differences here at home. And we've had a really, really rough couple of years globally. And what I think is that selfishness and entitlement actually might have spread almost as quickly as the virus. So what it comes down to is, how do we cure this? And it really comes down to kindness and selflessness. And now more than ever, we have to go back to our roots and our personal guidelines and principles and light the candle to illuminate the growing darkness. So why do we do this, and how do we do this? So you have to take what you've been given, the profession, your training, it gives you a lot, and you have to be willing to share it with others. And this is way more rewarding to your soul than you can ever imagine. We give, but what we gain in exchange is really beyond words. The mission abroad should always begin at home, and you don't really have to leave your city or your country to make a difference. Small acts of kindness in your community can really go a long way. And I was going to say that my calling for Foot and Ankle actually started in a homeless shelter. I was shadowing a cardiologist, and we had 20 patients scheduled, and this was in high school. And I was really excited to see these cardiac patients. And at the end of the night, it turned out that only 19, or sorry, actually one of the 19 actually had a cardiac issue. The other 19 were there to get free pairs of socks. And that was the very first time I started thinking about how important the feet are. And the cardiologist basically said he wished that there was a podiatrist or other foot and ankle specialists that would come and donate their time in the homeless shelter because the feet are really critical to survival. And that was really the first time I felt the calling for my profession. So these small acts of kindness can go a really long way. So I want to tell you a little bit about the inspiration that has, I guess, kind of driven me in my career to seek out opportunities to give back. And I'm going to go over some inspirational people that I've met along the pathway. This was a little boy named Joey Keller. He was actually he was 9 years old when I met him, but for 7 years he was perfectly normal. And then he developed this headache that just wouldn't go away. And later on, he was diagnosed with something called medulloblastoma, which is a really nasty brain tumor. And I had the honor of meeting him and was blown away by his love of others who were suffering. And he was just so compassionate. And actually, the reason I met him was his father was actually one of my surgical reps and ended up becoming a great friend of mine. But despite his own pain and illness, Joey really focused a lot of his short time on helping others. And he actually led a food drive to feed the homeless in Indianapolis. And they had over 400 people show up to the cold facility, all because of how he observed how miserable it was and how it felt to be without food and water when he was having his cancer treatments. And he looked at his dad and he said, "Dad, I hate this." And his dad said, "I know." And he thought he was talking about the chemotherapy. And he said, "No, I just hate being without food and water and being hungry." And he asked him if that's what it was like to be homeless. And that's kind of where that whole idea started. He also made it his mission to help other kids who were suffering during the cancer treatments. And he decided that his mission was to deliver Legos to these kids. And basically, it was his way to deliver kind of hopefulness and distraction to these kids while they were battling cancer in the hospital. And he did all this when he was really sick. And it was at the time I was actually a competitive cyclist, and I was deciding to try to qualify for Masters Track Nationals, which was being held in Indianapolis. And I had this idea of, instead of riding for a team, I wanted to actually ride for Joey. So I reached out to his dad and asked if Joey would be my coach, and he agreed to. And so I rode for Team Joey. And I was actually able to meet him, and you see the picture down in the right-hand corner. I presented him with the jersey that I had created for this special kit that featured Legos, which was his love. And unfortunately, after I met him about 6 days later, he ended up passing away. And that was about 6 months before I actually had the chance to compete in nationals. I just want to say that when I went to his funeral, there was over 100 police officers there. And I was like looking around going, what is going on here? It was really unusual. And then I found out that the mayor of Indianapolis, who also helped pack lunches for the homeless with Joey, had actually elevated him to chief of police for the day and gave him an officer's funeral. And after his passing, thousands of Lego sets have actually been delivered and cancer research dollars raised. And it all started with this little boy's footprint on humanity, which definitely will last several lifetimes. This is Moise Brutus, and talk about an inspiration. I met Moise when I was at a track in South Florida, and I was attending AOFAS about 2 weeks prior to competing in nationals. And I saw this kid out there, and I was just blown away that this guy was not only riding a track bike, which is actually really hard to do when you're able-bodied, but he was actually doing it with missing both of his legs and part of his left arm. And it was an accident that had happened a few years prior. He was actually a first-generation Haitian immigrant. They didn't have a lot of means, and he taught himself how to paint single-handed, and he was selling his paintings to raise money to achieve his goal. And his goal was to make the Paralympics and show people that life can happen and have meaning after amputation, or in his case, he had 3 amputations. So I went back to Indianapolis, and I helped him make some connections in the Indianapolis area. And the next thing you know, here's Moise coming up to Marian University on a full ride, which is a college in Indianapolis area. And they have a cycling team that's a perennial powerhouse. And not only was he their only Black athlete, but he was the only one with a disability, which ultimately, if you follow his story and you look him up, you'll find that he turned into a special ability. And what Moise taught me is that you should never give up in the face of adversity. Instead, you just need to give more. So mentor is someone who allows you to see hope inside of yourself. And this came to me when I met Dr. Tim Runyon of St. Petersburg. He took me under his wing when I relocated my practice. I was up in Indianapolis for the first 13 years of my career. And then I moved to St. Pete, and I've been here for about 6 years. But when I first got here, I met Tim, and he was just very gracious to me and helped me get started in the community. And I met a lot of people through Tim, but he was involved in an organization called Global Health Volunteers, and he invited me to attend one of the missions with him, which was really an amazing opportunity. I'd been on a mission as a resident and it was something that I'd wanted to get back to at some point. And what happened was he was getting ready to retire, and he wanted to pass the baton on to someone, and I was really lucky enough to have been chosen for the role. So I ended up going on that first mission with him. It was one of the most rewarding journeys of my life, and I think even Coach Joey would have been proud of me when I did that. And to date, Tim had served on over 20 mission trips to Chulucanas, Peru, and he loved the region so much that he ended up marrying one of the mission volunteers from Chulucanas and then retired and is now traveling the world with her. But he plans to eventually come back to help us with our efforts now that his career is over. And the other thing is that Tim introduced me to Sister Mary Jo McGinley, and she is also one of those inspirational people in my life. And I wanted to kind of tell you a little bit about Mary Jo. I'm going to start with this quote: "Vision without action is merely a dream. Action without vision just passes the time. And vision with action can change the world." And that's definitely who Mary Jo is. And I'm just going to play a little video that teaches you a little bit about Mary Jo and a little bit about the mission that we do in Chulucanas.
I think if you had to pick a word to describe Sister Mary Jo, it would be brave. Because brave goes across all aspects of life. You have to be pretty brave to go into places like Guatemala and Jamaica, where they say to Sister, they won't let us go into this town, but now that you're here, they'll let us go in. They shoot at us, when we go, but if you go, they won't.
Sister Mary Jo and the teams, they don't just stay in Chulucanas for operations. They go out to the outlying villages. They go far up into the Andes Mountains, and they spend days and days up on these mountains looking for the poorest of the poor.
When you're in Chulucanas, it's maybe like being in about 1920 or 1930 in the U.S. When you go up into the mountains, sometimes it's like the year zero, and you're on dirt-rutted, winding serpentine over the mountain, down the mountain, around the mountain, and you go into wonderful towns like Pacaypampa, Ayabaca, Huancaramba, and areas where the people may have never had the opportunity for a medical examination.
In our area, most of the people are farmers. They till the soil to get food just to feed their families, and not much more than that. Many of the poor are women. We had a number of women who have died giving birth.
They just looked and said, we thought it was normal for women to die during childbirth. If that can be helped, tell us what to do.
After she listened very carefully to what the people of the mountains of Peru said to her, that their mothers were dying, that they didn't know what to do about it, Sister Mary Jo put in place the Madre and Niño program, where the townspeople were educated and went back up into the mountains and educated the people there as to the signs and symptoms of a mother having problems during delivery or while she was still pregnant. And from that program, the number of maternal and child deaths was reduced dramatically, over 50%.
I like to think that my role was to be a facilitator and to be a connector.
Because of her joy, because of her smile, because of her being this connector, somehow brings all this together and makes a lot of things happen. It's like God's hand with Sister Mary Jo protecting the doctors, and sometimes under difficult situations, and then the operation's very successful, very blessed. You say, wow.
Sister Mary Jo is someone who inspires people to ask more of themselves. She allows them to reach to be their best. This is why I became a nurse, to really be with the people and do something that matters so much.
Just the resilience of the people, the desire to care for their families. It transformed my life and helped me to learn what's really important in life.
So basically, what I love about that video and Sister Mary Jo is this statement here: faith is seeing light with your heart when all your eyes see is darkness. What you're looking at in this picture is a family that was ducked way up in the Andes Mountains, and they suffered a major tragedy when their father and husband was in a horrific car accident and became a quadriplegic. And these people don't have a lot. You can see they actually a lot of times have dirt and floors in their houses. They're pretty poor, and he was dependent on a ventilator. And in the 2 years before we heard about him, he actually never left his bed, and he was staring at the same four walls for those 2 years. In the town that they were in would constantly lose power, and so his wife actually would have to sit by his bedside, and that way, if the town lost power, she could manually breathe for him until the power would come back on. And the kids, actually, who were quite young at the time, became the breadwinners and the earth tillers just to keep their family going. And our mission found out about him, and they got a Hoyer lift and a wheelchair donated. And they traveled back up into the mountains. This was during our last mission to deliver the special gift to the family. And what you're looking at in the picture is the first time that he was actually able to get out of his bed, go out of the house, and get fresh air. And all I can say is that everybody was crying. It was just such an emotional moment for the volunteers, for the workers. And there's a lot of these moments on these trips, and this is what makes the trips totally worth it. But such a small gesture can make such a big difference in the lives of these people. And it's not something that we experience here at home. I mean, those of us that are involved in foot and ankle, we know how practice can be. And there's days where people complain about the silliest things, the hammer toe that's straight is not straight enough or whatever, or the bill is too high or whatever. You go on a mission trip and it's never about that. It's just always about the fact that you're there and you're willing to help. And what I can say is that prayer lift, it's definitely not going to save this gentleman, but I couldn't help but feel that we had some level of impact on both his quality of life and his family's quality of life. So what does it take to go on a mission? They're definitely not for the faint of heart. That's for sure. It takes a lot of work. For a 1 week trip, for example, I spent months of prep time, spent countless hours doing grant writing, organizing, making lists, checking off lists, gathering donations from the hospital that I work at, from my patients who've brought in um, things like knee rollers, wheelchairs, boots. The supply list is huge, and you really have to spend a lot of time gathering everything that you could possibly need for both clinic and surgery, and you have to have this all shipped 6 months prior to going. So it's a lot to think about, and it really does cover a whole year's worth of time to go for 1 week. And these efforts are almost impossible without the help of supportive companies like Paragon tonight. And when we went, we had other companies that were able to donate. And I was able to get almost $750,000 worth of supplies, equipment, and hardware to make our mission possible. And a special thank you goes to industry for their support. And you see the ones on the right side, those are the ones that help support our trip. And just kind of a funny story, when Mark and I were going through customs, and we had all this stuff like bags full. Each bag was 50 pounds, and some of the bags had narcotics. And all it takes when you go through customs is for them to find one item in one of your bags that's expired or that they don't like, and they confiscate the whole bag, which can throw off your whole trip. And we got stopped at customs at like 1 in the morning, and we were exhausted. And the thing that got us caught was actually the Tris lapiplasty, believe it or not. It was really comical. For an hour, they were going back and forth and holding this little box that had the Tris lapiplasty plates in it. And I had to pull out my phone, and I was actually teaching these border guards about the lapiplasty. I think Tris would have been happy about that. But anyhow, that was the thing that almost threw everything off. But we got through, and Mark will actually tell you a little bit about our experience with all these items. So I'll leave you here in a minute here. But one thing that I can say is that some travel to see a difference, and others travel to make a difference. And I encourage everybody on this call to think about ways that they can make a difference. And you don't not even have to travel. We do have this thing going on in our homes currently, the crisis of COVID, and ER staffs and ICU staffs being pushed to their limits emotionally. They're short-staffed. They're sad about the state of affairs. You have all these sick people, not just with COVID, but people who've put off chronic disease. You have people who are having mental health issues, and the hospitals are literally on the verge of breaking down. So just even small gestures as sponsoring a lunch for the ICU staff or the ER staff can go a really long way. So your mission can start now. It doesn't have to wait until the borders open back up. Chulacanis, unfortunately, in Peru in general, has been ravaged by the pandemic, and it's made it very difficult for us to go there. And they just don't have the same technology or advances that we have here. But anyhow, start your mission now and find ways to help. And it can be small, but just like Team Joey and in Joey's vision, a small pebble can start a huge wave of great efforts and kindness. So without further ado, I'd like to turn it over to Dr. Mark Wavrunek.
Thanks, Adam. I will start off by saying Adam has kind of put it as an understatement of how much work he's put into setting up this Peruvian mission work. And I think some of the mission stuff that some people do, they probably have a lot of it set up already. But in Perler's situation, given that it was, it was his second time going, but it was his first time going as, as putting on himself. And it definitely took a lot of work when I got there and saw that he had 6 50-pound suitcases full of materials to bring out to Peru. I was kind of blown away, and that wasn't even half of it. I mean, there was many boxes, and you could tell that, like, literally he had been working on it for over a year. So like Adam said, my name is Mark Wavrunek. I kind of just got lucky in the situation that Adam asked me to be involved with the opportunity. I was in my fellowship with American Health Network in Indianapolis, and he had previously started his career in there. So he had the ties back with American Health Network. And because of that, I was lucky to be selected and have the opportunity with Adam. So just a little bit of background on myself. I finished my fellowship in Indianapolis, and then 2 years ago, I got a job out in Quincy, Illinois. I'm guessing a lot of you have never heard of Quincy before. I hadn't until I came and did an interview here, but it's a little town, about 45,000 people on the west side of Illinois. And these are my 2 kiddos, Harrison and Everly. For this last week, I've been dealing with the new parent trials and tribulations, with both of them vomiting and having diarrhea. So that's been a mission in itself. But so I'm just going to talk about my experience a little bit with doing this. This was my first mission trip that I had gone on as far as medical mission trips. And so I think the experiences for a lot of people are going to be different, but this is just kind of what I experienced. So I think a lot of them are in rural areas with the Global Health Volunteers. They're in places such as like Haiti, Jamaica, and a couple different locations in Peru. But to get out there, it was an undertaking of about 4 or 5 different airports and a bus ride and a taxi carrying Adam's about 300 pounds of supplies, which was also a mission in itself. So a little bit about Chulacanis. It's a town about 52,000, and it's surrounded by the Andes Mountains. So it's a beautiful landscape. And what they're known for is actually their pottery and some other small industry, but mostly just pottery and farming. So transportation in this community was via these motorbikes, which was an experience in itself. Sorry, can you guys see my presentation okay?
Yes, we can.
Okay. So as far as some of the accommodations at the facility, the picture on the left was the living quarters. So Adam slept on the left and I slept on the right. So even though we knew each other a little bit, we definitely got pretty close over the week that we spent there. But some of the things that I think you'll experience on a lot of these mission trips in third world countries is that you're sleeping in places with no air conditioning. Every summer in Chulacanis, they have a rainy season where the sewer systems get flooded and it contaminates the groundwater. And for people who grew up in America and take water for granted every day. It was an experience for these people because just simple things such as washing their toothbrush off after they brush their teeth, it would result in a situation where they would have vomiting and diarrhea for a couple days after. As well as, it's the simple things like being able to flush your toilet paper and things of that nature. But with Global Health, I mean, it was a facility that was actually probably one of the nicer areas in the community because they had people coming from outside volunteer opportunities and organizations multiple times a year, and really had it set up to accommodate people coming into town. So as far as the clinic, we spent 3 days in a clinic that was basically in a school that was out for the summer. And they just set us in the classroom and gave us a little medical chair and said, here you go. And we saw about 100 patients, and it was everything from ingrown toenails to a variety of musculoskeletal conditions. So surgical considerations are really different. Adam kind of explained it as, you learn how to treat pathology in the United States via the textbook manner, but in a third world country, you have to take a lot of different things into consideration. These people potentially are coming from the mountains, and they'd be, riding a horse and then taking a bus and a taxi, and then finishing that up with, a couple mile walk into town to receive treatment. And you have to understand that they'll be making the same trip back as they go back to their families. And if there's someone that you're considering surgery on, unfortunately, you're a little bit limited. And I felt like some of the pathology that we were seeing that was most significant, that people wouldn't tolerate in this part of the world, was coming from the mountains. And those were the people that you probably could have made the biggest difference with from a surgical approach, but they were best treated in a conservative manner. You also had to think about, what type of household they were going back to with dirt floors, or if they were more well-to-do and actually had concrete or tile. So just taking different things into consideration that you typically would in the United States. So this was the hospital in Chulacanis, and kind of some of the things that some of the patients expressed to us, as an example in the picture on the right, where some of them had a hard time trusting the medical practitioners that were working there year round, mostly because liability reasons. They weren't very reliable. They wouldn't show up to work. And this is an example of that, where it was 10:30 on a weekday, and all these people were waiting to be seen by a physician that unfortunately didn't show up that day. So they're just waiting in the hallway, not knowing if they actually will receive care. There was also always concern that there was providers that were practicing without license. So when people came into town with Global Health, it filled up your time slot pretty quickly, just because they felt like they were getting something as far as management of their pathology that they wouldn't maybe get from the local physicians. And then the picture on the bottom was an example of at Global Health. They had a place for the patients to stay after they had received surgery. And it wasn't just Adam and I that were there. They had a general surgeon and I think a urologist as well. So as far as accommodations with the operating room, that's our wash station on the left. They didn't have air conditioning in the hospital, so the windows were open, so occasionally you would get flies in the operating room. So that was an experience. Other things we had to take into consideration is there was no C-arm, so kind of limited, what you felt comfortable with doing as far as, throwing hardware. You don't want to make a situation worse by a malpositioned screw. So you had to take that into consideration as well. So we kind of joked about the situation Perler was talking about, the Lapiplasty. This was one of the women that we treated for a bunion. And one of the nice things about the Lapiplasty is it has the pre-measured screws. So it made it easy to do a Lapidus on a larger bunion without the help of a C-arm. Well, we joke that this is the most expensive bunion in Peru. As an example of, how you kind of throw out the textbook way that you would maybe fix something in the United States. Like, this was a kid of one of the employees with Global Health that had a flat foot, and rather than doing a reconstruction with the Evans osteotomy and Kidner and calc slide, he was best served with just doing an arthroresis and a gastroc recession, just for the reasons of the quicker recovery time and the lesser chance of an infection, given there's smaller incisions and things of that manner. And just another example of a bunion we did. This was an individual that worked in a mango farm and had this mass that had been bothering him for multiple years. And when we went and visited him in the post-operative area, you can't tell, but underneath this pillowcase, he had limited funds as far as money goes, but he was extremely grateful, and he had carried a whole pillowcase of mangoes to give us after the surgery that he had been hiding underneath his head in the recovery area, which was a nice gesture. I just threw this in there because it's an example of individuals. So this guy had a non-union tibial fracture, and given that we're only there for a week's time, you don't want to be doing surgery on someone that's going to need fairly extensive follow-up care and monitoring. So we gave him that peg crutch for him to get around on, and connected him with an orthopedic surgeon who would manage this for him later, where normally someone like this wouldn't have the connections or the resources to get in touch with someone who is local that would provide volunteer service as well for this type of pathology. So you can't personally help everyone yourself, but you can guide them in the right direction to receive help. And this was another kind of sad story where this man was carried in by his brother, hoping that we could do something for his gangrenous infection. And unfortunately, he had significant peripheral vascular disease. And I think Adam and I potentially would have felt comfortable doing a below the knee amputation, but his circulation was so diminished that, he really needed an AKA, and would have done better with a vascular surgeon. So again, a situation where we got him in touch with someone else in a larger city. But they were a little traumatized by the situation. And the picture on the right is the brother kind of running out with the guy, because they felt that his time was limited and it was just a matter of time. So, doing these missions, you're obviously there to help others, but it definitely is an experience where you get to go to a new place and experience new things with new people. And we did have some free time to go around and travel and go to some nice Peruvian restaurants and enjoy ourselves while we were there as well. So I think just some of the takeaways, kind of like Perler said, you don't have to go on the other side of the world to make a difference. Although doing these mission trips in foreign countries has its own unique challenges and provides amazing experiences. It kind of submerges you in a new culture, and you kind of get this unique self-fulfilling experience that it's kind of this unanticipated personal growth that comes with helping these people, and you get this newfound gratitude and humility from serving these people in these underprivileged communities. And I think a lot of the time you gain just as much as the people that you're serving, and it truly is a unique experience. So that's all I have to share. Thank you.
And unfortunately, Dr. Mark Myerson was called away at the last minute, and he wasn't able to make the live meeting, but he did go ahead and record his presentation for us. And also, I just wanted to point out what Mark was saying. When we're in that small town of Chulacanes, we almost have to serve almost like an urgent care, and we can do some basic stuff. And then the next city over is Lima, and Lima could do, Peoria. Peoria could do a little bit more. They had a couple orthopedic surgeons there that did ORIF and did have X-rays, and they had vascular specialists. So if we caught something that was bigger, we would communicate with that doctor. Sometimes they would actually travel out to Chulucanas to see the patient with us. And ultimately, the really big surgeries and the big reconstructions happen all the way over in Lima. And so sometimes part of our mission is identifying the individuals. And then when we get back to the United States, we create funding and pathways that they can go to Lima and get more comprehensive care. And I think that that's something that Dr. Mark Myerson and his Steps to Walk is really focused on, is how do you take that next step from kind of out in the mountains to kind of these bigger triage cities where you can not only impact the lives of each individual, but you can also teach the doctors in that area how to treat and manage a lot of these conditions. So without further ado, we'll go ahead and hear from Dr. Myerson.
Hello, everyone. I'm Mark Myerson, and it's really a pleasure for me to share my ideas about humanitarian service this evening with you. I'm terribly sorry that I cannot be there with you all live, and hopefully in the future we'll have another opportunity to connect potentially in a different way. Let me share my screen, and I'm going to talk with you all now about humanitarian service and how this all came about in my recent career. So as you may all know, I started a humanitarian organization called Steps to Walk 6 years ago. I left hospital practice and decided to devote my future career or life to humanitarian service. And I'd like to share with you a little bit about our global humanitarian programs, who we are, what we do, and what are some of the issues that we face in the world today. It's terribly important to understand this in perspective of the almost 320 million surgeries that are done annually. Only 6% are performed in underserved regions of the world. It's an astonishing number. So there's obviously the need. And I want you to think about the impact of these terrible deformed feet on this young boy, Joseph, whom I treated in Namibia. You can see the corrected foot on the right side, and I went back subsequently to treat the opposite foot. But it's not just a deformity. This young boy cannot walk. He cannot be educated. He cannot work. He has very limited, if any, work potential. And it impacts not just him, but his entire family and community. And you need to bear that in mind in terms of the kind of work that we are doing. It's not simply a corrective procedure. When we go to these rural communities in the world, you must recognize the cultural difficulties with patient care. Their only goal, all they need is a plantar-grade foot, and for some of them, all they want is to fit in a shoe. And it's very, very different from our goals as surgeons here in the Western world. Their expectations are completely different. And the follow-up of these patients is peculiarly different, and it requires a lot of planning by our organization prior to going into any hospital and community. And you need to remember that resources, in particular equipment, is rarely available. So I'll give you an example. This is a young girl I treated in 2009 in Colombia. And the deformity is obvious. She had a snake bite when she was 1 year old at the front of the ankle. It dehisced, and she developed what amounts to a burn contracture and this terrible calcaneovalgus deformity. So, of course, how are you going to treat this where you have no resources? And obviously, treating somebody with a Black & Decker drill is not that common. But the fact is that this is a very real issue sometimes, where we just have very little resources, and we've learned to do more with less. And this is a mantra that we have throughout all of our programs. Here, of course, is the corrected foot, but now I've got to cover the skin, but there's no dermatome. What are you going to do? Well, I went to her groin and took a skin graft it's a full thickness graft from the groin, which is easy to suture together, defatted the graft and applied it. So you need to be able to think out of the box and do more with less. The work that we do is terribly relevant, and ask yourselves this question: what are you doing for others? Because it's what we do for others who never have the ability to repay us that is so important in life today. Now, as surgeons, we want to correct deformity. This is obviously very, very important for us. And this was something that happened to me 15 years ago when I was in Colombia, treating this lady with polio. And at the end of the week, when we changed her bandages and looked at the foot, it was a very emotional experience for the patient and her family, and their appreciation was enormous. Well, I returned back to my home hospital later that night, and the next day, my very first patient in clinic was a lady. I'd done second toe surgery on her, and the toe was a little swollen, and she was complaining and complaining. And of course, let's put it into perspective. The work that I'd just done on this horrible deformity and the second toe deformity. And I began to realize that humanitarian service had a different implication for me as a surgeon and what I potentially wanted to do later in my life. But what we realized is that for our work to be sustainable, we needed to educate the local surgeons. You cannot do humanitarian service by going in, performing a surgery or surgeries and leaving. Doesn't work like that. In order to be sustainable, you must educate the local and regional surgeons. You know the saying, give a man a fish and you'll feed him for a day. Well, here's a terrible clubfoot deformity. Here it is treated. That's very nice, but you've not really done very much in the scheme of things. So you need to teach, and of course, you'll feed a person for life. And that's really what we want to do. Surgeon education is essential. And what we do on each of our humanitarian programs is to invite regional surgeons in to the meeting so that they're there with us for the entire week to participate in the program. And education is so important. Many of you know that I'm South African. This is a quote from Nelson Mandela, that education is the most powerful weapon that you can use to change the world. And indeed, as surgeons, we need to be educators. So our mission for Steps to Walk, of course, is surgical care, but educating surgeons around the world. These are the places in the world where we are currently working, and we go to each of these locations once or twice a year. And we add 2 to 3 countries annually to our global network. It's important to recognize that there's a huge area of the world where they just don't have safe and affordable surgery, as you can see here. Now, why is our work necessary? It's not really because we want to treat this individual with this fixed equinus deformity. It's much more than that. Perhaps in the places where we are working, there are no resources, there are no surgeons, there are no surgeons who have the requisite skills to take care of these problems. Sometimes it's that there's limited foot and ankle delivery of service to the public. Now, it doesn't mean that in some of these countries that there's no foot and ankle expertise. Quite on the contrary, in many of the places we work, Brazil, Chile, Argentina, you've got excellent foot and ankle surgeons, but the public can't access them. And that becomes a very real issue. And then, of course, in some other places, you have deformities that are extraordinarily difficult to treat, and there's limited expertise to treat these problems. And I think that's why there is a very relevant need. On each program that we go to, we take 4 international surgeon volunteers, in addition to residents and fellows with us on each humanitarian program. And for you all, we welcome you as participants, whether or not you're an active volunteer, If you're a more senior surgeon, you can join us as an active volunteer. But for the younger surgeons who don't have enough experience, come with us. We will try to obtain a grant to support your visit on these programs. We have a large number of international surgeon volunteers who generously donate their time and skills to these programs. It's very important to include the local healthcare or foot and ankle leadership of the country on each of these programs. We cannot go in and perform surgery and assume that we know more than the local surgeons. It's just not possible. Many of these local surgeons are outstanding surgeons, but they just don't know the principles of foot and ankle reconstruction. So it's very important to include them in the leadership. So we have a 5-day program that is standard for all of our humanitarian programs. Day 1 is lectures, conferences, and cases. Day 2 is examination of patients with practical teaching. This is very, very important because this is bedside teaching. It's not just examining patients, but from the 30 or 40 patients that we examine, we select about 20 for surgery over the next few days, and these surgeries are done live with teleconferencing into the local conference room, where we have moderators communicating with the surgeon leader in the operating room. And on day 5, we have a cadaver lab, and in those countries where this is not possible, we'll do a case conference for the entire day. So our goal is to educate international surgeons. We use our volunteer surgeons worldwide, and the most important aspect of what we do is continuity. You have to return regularly to the same location so that those surgeons there are enabled. You want to empower the local surgeons. It's so important. Our goal is obviously to have a long-lasting impact in the world, and the only way we can do it is to reach those in the most need. So let me show you a case here. This is a young girl, profoundly disabled. She's never walked. She has this terrible calcaneovalgus deformity and is able to shuffle a few steps at a time. Now, planning the correction of this profound calcaneovalgus deformity is difficult. And we have to do bilateral surgery. And you can see, you can see here what I did. I did bilateral tibio-talo-calcaneal fusions, a TTC arthrodesis. I had to balance the foot. Here you can see there's a forefoot supinatus. So I did tendon transfer, transferred the anterior tibial tendon, as well as a navicular cuneiform fusion. Once I was done on the left foot, I went to do the right foot. And here you can see, here you can see her walking now about 5 months after the surgery. This is the first time that she'd walked in all her life. It's a very, very relevant experience. Here's a young man who has this terrible deformity, but with awful skin. And you have to plan this carefully. So I was only able to do this TTC arthrodesis posteriorly. And you can see here, this is a technique which I've described using an acetabular reamer to expose the joints. I then go posteriorly using an acetabular reamer on the posterior iliac crest, harvests a lot of bone graft. And you can see here, the reason for that bone graft is so that you can apply the graft posteriorly, all the way down here over the back of the tibia. So you have a tibia to calcaneal arthrodesis, which is extra articular, which is so important, and then plate fixation. We treat a lot of children, and treating children is a very gratifying part of our work. This is a child who's 2 years old with CP, and I used a method described by the Italian surgeons as a calcaneal stop to block her foot. And you can see here she is post-operatively. This is about a year post-op after I took out the screw on my return visit, where she now has a completely plantigrade foot. This is not uncommon. This is a child with arthrogryposis who'd never worn shoes, and you can imagine why. And here he is, probably about a year after his surgery now, ambulatory and wearing shoes. You know, the work that we do is very, very gratifying. It's quite humbling for us to go back and see the results of the work that we have done in these terrible deformities. Take an example of this child with polydactyly. This is duplication of the hallux, which was treated incorrectly, unfortunately. And you can see her here preoperatively with these rather severe deformities. She was not able to wear shoes. And you can see her here after the one side had been done by one of my colleagues from Brazil. And I went back to do the opposite foot at the subsequent year visit. So I want to share also a little with you about our virtual education platform. Obviously, over the past year and a half, it's been quite difficult to do on-the-ground visits because of COVID. So we started telemedicine education. And what I'll take you through here is truly the most remarkable ability for us to educate surgeons globally. These are surgeons who are wearing these glasses made by a company called Vuzix. And in real time, I can sit at my desk, or we have mentors around the world who are able to take the surgeons through surgery live. And I'm able to use, if you look on the bottom left here, I'll show you in a minute how it works. I'm going to be able to point to him, and he's seeing my pointer in his visual field, so that live, I'm able to take him through this actual operation. It's really incredible. So here you'll see the surgeon is examining the foot, and I'm telling him what I want to see during the course of the training.
You want your saw to come to that point, and then you just crack it. There you go.
So this is what he is seeing. He is seeing my pointer on his visual field, and I'm able to tell him in real time what to do, which is really impressive.
What I want you to do now is to put one pin across here, there. Okay. Okay. So you can either come from the it's easy to come from the fibula and just come across, or from the tibia here, coming across. You have to come across the osteotomy.
And this is a case that we did together.
So it looks like from the scar, she's had a very extensive posteromedial release. Okay. So it's very flexible. It's very reducible.
It's flexible. As I told you, the tenorecular joint is also reducible.
So here you'll see the osteotomy there. The ankle joint now is completely parallel. That's exactly what you want to see.
So we are running these programs.
What you're going to do is
we are running these virtual programs now 3 times a week in 9 countries. So we have a lot of mentors globally who are working with us on these telemedicine programs, which is truly absolutely remarkable. Now, I want to leave you with this thought. You know, the meaning of life is to find your gift, and the purpose of life is to give it away. I've already told you what I truly believe in is that you cannot experience this anything to the full unless you do something for someone who can never repay you. And that's really the essence of what we do and why these experiences are so joyful. You know, we'll take you out of your comfort zone with some of these surgeries. You will learn to operate out of your capacity, and you learn to do more with less. But the experience is incredibly enriching. Now, for those of you who want to contact us, please write this down. We can be reached on our website at Steps to Walk, or you can contact Shuyan. Shuyan is our international program coordinator, and she will welcome applications from any of you to join us, either as a volunteer surgeon or to participate actively in our programs. Thank you very, very much for sharing your time with me.
Okay, so Mark, if you don't mind hopping on, we can, at this time, we can field any questions regarding mission medicine. You've heard a little bit about two different styles of missions and missions that have different purposes, but ultimately kind of the same at heart. And we're happy to answer any questions that you might have about working on mission trips or getting involved. The Global Health volunteers, you can go to their website. They do have other missions that they do, and then Steps to Walk. Something that I spoke to Dr. Myerson about, one of the goals of this meeting and this whole education series is to support fellowship training in the state of Florida and to promote it. And as you saw when we started this whole lecture, we had a discussion from one of our sponsors, and each meeting is going to have a unique sponsor, and it's a chance for industry to show their support of fellowship education. And the money that is used to sponsor this goes towards fellowship training opportunities in the state of Florida, where all of our fellows would have access to go to mission trips and have grant money. And you heard Mark Myerson talking about that, where they are taking DPMs and MDs. They're open to taking fellows. And if a fellow is interested, they can apply, and then they try to find a grant. And that's kind of where the Florida Foot and Ankle Fellowship Society can come in and help do a sub-grant to make that possible for the Florida fellows to go, or fellows from elsewhere in the country. So, it's kind of a call to action. And hopefully with Dr. Wavrenek's discussion and my discussion, maybe at the very least, we've gotten you interested in kind of going beyond your offices and playing a role in helping other people. So if anybody has any questions, feel free to ask. Quiet crowd. Well, I just, on behalf of the FPMA and the Florida Foot and Ankle Fellowship Society, I did want to thank everybody for coming out tonight. We really appreciate the support, and hopefully it's been a good meeting. And we also want to thank Paragon 28 for their sponsorship this evening and of the society. And then also, again, Dr. Mark Wavrunek and Dr. Mark Myerson for taking their time and giving us a little bit of insight into what it takes to go on a mission and kind of the heart behind it. Please look out for our up and coming lectures. We do have one. It's going to be the last Thursday of every month. The next lecture series is going to be by Dr. Bradley Lamb and his fellowship, and they're going to be talking about minimal incision bunion surgeries and the good, the bad, and the ugly. And then the month after is going to be Dr. Andrew Bellis and his fellowship, and they're going to be focusing on arthroscopy, tips, quips, and pearls for that. And then the calendar will fill out. We are going to do this series every Thursday, or every last Thursday of every month through July of 2022. We hope it's been a fun evening, and we look forward to having you guys all back for the future series. They're going to be great topics all year long, and we would love for everybody to participate. Mark, do you have anything?
No, well said. Thanks.
Thank you, guys, and we can go ahead and in the session if nobody has any comments. Let me just double check the chats. And it looks like there were no questions. So thank you guys very much again, and sincerely from the bottom of our hearts, we really appreciate you taking the time and spending the evening with us. We know you have a lot of other things to do, and we appreciate your support.